Chapter 7, Patient Engagement. Engaging patients in the care process by leveraging meaningful use goals. Patient engagement is becoming a dominant theme in healthcare today. Many see the patient as the greatest and most valuable untapped resource in healthcare. This framework provides a pathway toward fully integrating the individual into his or her own care. This framework also aligns patient engagement to the patient-facing requirements of the meaningful use rule that the U.S. federal government has set forth. So the patient engagement framework that I'm talking about is a 5-phase continuum used by hospitals and other care providers to gradually expand the methods and tools for informing, engaging, empowering, and partnering with patients and their communities in order to improve both the quality of care they receive and their overall quality of health. Here's a great diagram explaining a little bit about the patient engagement framework. The first column is inform me, and then engage me, empower me, partner with me, and support my e-community. And I'll discuss each one of these topics here later on in this presentation. This framework is a guide and not a prescription. For the provider, this framework is to tap the power of the patient-provider relationship and achieve better care, health, and cost. Now for the patient, the framework is to empower better understanding how to achieve the health outcomes that matter most to that patient. So the 5 stages are inform me, which means this stage makes it easier for providers to help patients find and understand care information. Engage me. This stage supports provider interaction with patients to improve care. Empower me. This stage enables patients to become an integral part of the care team. Partner with me. This stage facilitates provider-patient partnership through shared care planning. And then finally, support my e-community. This stage expands the network of patient support to include community. So let's talk about meaningful use for a second. The provision of financial incentive for provider who meaningfully use certified EHR technology to improve results over time. This grounding patient engagement in such important policy initiatives will help guide the development of future population health and patient engagement strategies and strengthen the provider-patient relationship across a continuum of care. So the first level is inform me. This level is about providing patient information. So the goal for the provider, make it easy for me to point my patients to information I want them to access and understand. This level of framework provides modest benefit without disrupting clinician workflow. And then for the patient, make it easy for me to find accurate, up-to-date information relevant to my healthcare and medical needs. Most healthcare systems address the inform me need through their patient and marketing portals. Providing health information through the hospital's website adds a degree of authenticity that leads patients to trust the information and feel more comfortable sharing what they've learned with their trusted clinicians. An example of this would be directions on where to park. So you would go to the facility's website and it would give you information as far as parking options at that facility. Even before health information technology, progress was made with respect to educating patients at this inform me level. Tools like self-care handbooks have been critical in helping patients to determine when and where they should seek care, if at all, and to decide whether home treatment and self-care are efficient to manage symptoms. Example, Kaiser Permanente and the Veterans Association's use of self-care books. Now, in some cases, some patients use a clear, understandable health information has helped the patient seek life-saving treatments. Printed educational materials, in addition to health information technology-enabled tools, can contribute to greater patient engagement and loyalty. The next level is engage me. This level requires some level of interaction and provides value to both patient and clinician. Also at this level, there is an expectation that the patient will be proactively informed. So goals for the provider, help me interact with my patients and recommend steps they can take to improve their health. And then of course the goal for the patient, make it easy for me to understand my provider's instructions so I can do self-care well. I want to talk just a second about information therapy. Information therapy is a prescription of the right information to the right person at the right time to help that person make a better health decision or improve a health behavior. Just as treatments or medicines can be prescribed and reimbursed, so can health education. Here are some results of patient engagement at this level. In one study, patients suffering from depression were given interactive engagement tools. These patients showed a 33% increase in antidepressant medication adherence and lower overall depression scores, resulting in a 61% increase in satisfaction with treatment. In another study, patients with diabetes who used an online patient portal to refill medications increased their medication adherence and improved their cholesterol levels. Patient reminders can help patients keep their upcoming appointments, reducing a no-show rate, as some providers do give, and assist them in remembering preventative cancer screenings or flu shots, thus improving scores on quality measures for providers. This level includes many automatic nudges and interactive tools to help patients remember what's next and why it's important. If performed correctly, the effects on treatment adherence and satisfaction can be quite powerful. Patients also at this level can view and download their electronic medical records. With this access, patients can step up to informed roles in their own healthcare team. They can also look for errors that could be detrimental to their health. This information can also inspire them to take their care seriously and to stick to their health and lifestyle goals. Level 3 is the Empower Me level. This level offers the patient greater status and influence as a member of their own care team. Also, the patient is considered a sufficient source of truth, such that patient-generated data enables patients to interact with the record digitally. This level, this level gives birth to the pre-visit. The pre-visit is when a patient responds online to an interactive questionnaire developed by clinical experts. This questionnaire will dive into symptoms, concerns, and preferences around a specific health problem or condition. Eventually, the use of the pre-visit will become routine. So the goal for the provider at this level is the information I learn from my patients help me provide better care. And then the goal for the patient is make it easy for me to be part of my healthcare team. Now I'm just going to touch briefly on secure messaging. As noted in a meaningful use case study, secure messaging actually cuts down on the phone calls and the back and forth. This is the primary work tool at this level. This adds time dimension to the relationship. As an example, the patient reporting how a certain treatment is working or not, if the symptoms are worsening or actually improving. Secure messaging expands the patient-provider relationship by allowing the full care team to become involved. Nurses, care coordinators, and others will be able to monitor the message and respond without involving the primary physician. This would be a quick reply and gives the patient the confidence that their response will be reviewed at a later point in the clinician's workflow. Health education campaigns are also used in this stage. A patient engagement campaign is a series of educational experiences presented to a select group of people who are facing a common health problem or moment in care. Health education campaigns can increase a patient's activation by 30%. Patient decision aids. This stage promotes the use of patient decision aids to support shared decision making. These aids are helpful in presenting the risks and benefits of an option presented. Here's some information regarding a study that was done at the Geisinger Health System. Here they talk about their medication list and provide feedback online to providers through the patient portal. And as a result, providers reported that they were able to keep medication lists updated more efficiently. Patients were eager to provide feedback on medication data and felt that it enabled them to track their medications in a more effective manner. Pharmacists made patient-suggested medication changes in 80% of the cases, and providers found that the online communication with patients resulted in time savings. Further, patients indicated that pre-visit online messaging improved the quality of communication with providers during the actual office visit. Level 4 is Partner with Me. In this level, the role of the patient is elevated from being the recipient of care to being full partner with the provider. Every clinician decision becomes a shared decision, and every care plan becomes a shared care plan. At this level, the patient and the care team have shared accountability for achieving the outcomes that matter most to the patient. The personal care plan is a primary work tool for this level. So the goals for the provider and the patient would be to help us clarify and record what we know and do together to manage patient health. As I said in the last slide, the personal care plan is the primary work tool for this level. Personal care plans bring together all of the care plans, wellness goals, and supporting resources available to help a person achieve the outcomes that matter to him or her. A personal care plan integrates the patient with the care team members chosen by the patient. This team participates in a variety of roles and responsibilities, with the patient highly integrated at the center of care. Ideally, the patient's values, goals, and health status inform the process and the participants in a fluid and seamless way. Advanced directives are essential in this level. These directives are needed to balance the risks and benefits of late-life treatments. Patients and their family caregivers should be given a clear view of the benefits and risks of each proposed treatment. Risk could include increased likelihood of dying in a hospital, connected to tubes surrounded by machines and strangers instead of at home. Most people want to avoid this situation, thus advanced directives are necessary. This slide is about the impact of shared accountability. UCSF and Stanford Medical Center study showed that with collaborative care planning and decision aid use, more patients reached an informed decision during the first visit. Patients reported higher confidence in knowing what questions to ask the doctor or physician. Surgeons believed questions asked by the patient were appropriate. Surgeons reported greater efficiency and clinical encounters. And then surgeons reported greater satisfaction with these clinical encounters as well. This final level is Support My E-Community. Providers go outside of their walls and networks to incorporate the social determinants of health for the population they serve. They don't have to wait until the completion of levels 1 through 4 before engaging in the community. Reductions in readmissions and unnecessary emergency department visits happen when providers and hospitals invest in social workers. So for the goals for the provider and patient at this level, expand and include the co-producers of health of the patient. And then goals for the community would make it easy for me to support the patient. Researchers at New York City's Mount Sinai Hospital have found that patients' relationships with care providers and their ratings of the quality of care all depend on the way care is delivered. Care delivery encompasses an array of factors such as patients' use of health information technology, quality of patient-provider rapport, degree of connectedness patients feel to their care facility, patients' confidence in their decision-making ability, as well as how informed patients feel about their health. In regards to access to e-communication, the use of health information technology, or HIT, is another factor that reduces the gap in care experiences between higher and lower income populations. In particular, sending and receiving emails and text messages to and from providers. Efforts to open these communication channels should help address the discrepancy between low and high income patients in their satisfaction with their care. So the overarching results of patient engagement: patients receiving care from providers with whom they shared in decision-making showed a 12.5% reduction in hospital admissions, as well as lower costs. The delivery of clear, easy-to-understand patient education has been shown to reduce admissions for heart failure, and then also ultimately, more engaged patients incur lower costs, while less engaged patients can generate up to 21% more health costs. The tools discussed here that support each of the 5 stages can positively affect change and influence the achievement of better care, better health, and lower costs. So this concludes Chapter 7. If you have any questions, please let me know. Thank you.